Hey everyone, and welcome. Today, we're diving into two of the most incredible tools in all of modern medicine, CT scans and MRI scans. I mean, think about it. They give doctors a kind of superpower, right? The ability to see right inside the human body without ever making a cut. So, how do these superpowers actually work? And how do doctors decide which one to use? Let's get into it. So, you've definitely heard of them. Maybe you've even had one. But what really separates a CT from an MRI? Why would a doctor order one and not the other? That's the big question, and that's exactly what we're going to break down. You can think of them as these super high-tech detectives. Each one has its own special way of gathering clues from inside you to help solve a medical history. But, and this is key, they use totally different methods, which means they're built for very different kinds of cases. All right, first up in the ring, let's meet the CT scan. If this technology had a personality, it would be that fast-acting, get-it-done-now kind of hero. Its defining feature? Pure, unadulterated speed. So how does this thing actually work? Well, a CT scanner is basically a very, very sophisticated X-ray machine that spins all around you, just snapping pictures from hundreds of different angles. Then, a powerful computer acts like a digital artist, stacking all these flat, 2D slices together to build a detailed 3D model. It's like seeing a loaf of bread, but also being able to see every single slice inside it all at once. Pretty cool, right? So where does this need for speed really shine? You guessed it, emergencies. The CT scan is the absolute go-to tool when things get serious. Think about it. Potential internal bleeding after an accident, a sudden lung issue, or a severe injury to the abdomen. In those situations, every single second counts, and that's where the CT scan is just invaluable. Of course, there's always a trade-off. CT scans use X-rays, which means there is some radiation exposure. It's very carefully controlled, of course, but it's a factor. On the plus side, they're usually the less expensive option, and they're generally safe even if you have most metal implants, like a hip replacement. And now for our second contender, the MRI. If the CT scan is the speed demon, the MRI is the meticulous artist. It's all about depth and richness and just incredible detail. The technology here is a whole different ballgame. An MRI uses powerful magnets and radio waves, so get this, zero radiation involved. It essentially coaxes the water molecules in your body to line up, and then it captures the tiny signals they send out as they relax back to normal. This process allows it to create these just stunningly detailed images, especially of our soft tissues. And this is where its specialty for detail becomes crystal clear. You need to examine the brain for a suspected disorder, check on a torn ligament in a knee, get a really clear picture of the heart. The MRI is the #1 choice for these jobs because of its amazing ability to tell the difference between different types of soft tissue, something a CT scan just isn't built for. The trade-offs for an MRI are different, though. The biggest advantage is huge. Absolutely no radiation. But on the downside, the process is way longer. We're talking 30 to 60 minutes. And it's more expensive. Plus, here's a critical safety point. Because it uses those crazy powerful magnets, it is not safe for people with certain kinds of metal implants, like older pacemakers. All right, we've met the contenders. Now it's time to put them side by side for the ultimate showdown. Let's really break down how they stack up against each other. When you boil it all down, this is the core difference right here. On one side, you've got the CT scan, defined by its use of X-rays and its unmatched speed. On the other, the MRI, using magnets to get that unparalleled detail. It's really speed versus detail. And the difference in time is just dramatic. A CT scan is often over and done with in the time it takes to listen to a couple of your favorite songs. An MRI, on the other hand, is more like settling in to watch a whole episode of a TV show. And you can imagine the difference in duration is a massive factor for doctors, especially in an emergency. So putting it all together in one place, you can really see how that core technology, X-rays for CT, magnets for MRI, causes all the other differences. The speed of the X-rays makes the CT perfect for emergencies, but it comes with that small dose of radiation. The MRI's magnetic approach gives you that incredible radiation-free detail in soft tissues, but it's going to cost you more in time and money and has those critical safety risks with some metals. So after all that, who's the winner? Well, that's actually the wrong question. This isn't about one being better than the other. The real verdict is all about strategy.
about choosing the absolute best tool for a very specific job.
And this, right here, is the most important thing to take away from all of this. There is no better scan overall. There is only the right scan for the specific question a doctor is trying to answer.
So here's a simple way to remember it. The CT scan is the ER specialist. It's fast, it's efficient, and it's perfect for those life-threatening, time-sensitive situations. The MRI, on the other hand, is the detailed detective. It's going to take its time to meticulously investigate complex cases hiding deep within the body's soft tissues.
The bottom line is that both of these technologies are absolutely vital, and a lot of times they're complementary. By providing the right answers at the right time, they empower doctors to make life-saving decisions and figure out the best possible treatment plans for every single patient. All of this makes you wonder, we've come so far, so where do we go from here? What happens as these technologies get even faster, even more detailed, maybe even combine? What new windows into the human body are they going to open up for the next generation of medicine? It's pretty exciting to think about. Thanks for watching.